Very good evening, friends. Welcome to another series of the conversation with my TTT alumni. The objective of this conversation is to hear from the experts who I had the privilege to learn from while they attended my Train the Trainer program. And today, it's a great honor to have Dr. Shan Narayanan, who is a famous pediatrician, author, HRD Corp Trainer, and a leader. We are going to discuss why leadership and people skill matter to be a successful medical doctor. Who is a better person to answer this? A medical doctor with vast experience, who is a leader himself. Dr. Shan, I know how busy you could be, and it's a great honor to have you in this series. Welcome, and thank you very much.
Thank you, Dr. Prabha. Thank you. Thank you very much for inviting me to join you to have a conversation with you regarding leadership and people skill.
Yes. Wonderful. For the benefit of the audience, Doctor, shall we start with a little bit of background about yourself?
Yes. Thank you for the question. See, I have a diverse background. Professionally, I'm a pediatrician. And by passion, I'm a coach, trainer, and a public speaker.
Nice.
Well, medical school, I completed my medicine MBBS in 1987. And then I went on to train in UK, and in 1996 I qualified as a pediatrician. So I've been a doctor for 36 years, of which 27 as a pediatrician, and 20 years of that 27 years I spent mainly with I do general pediatrics, but I also spend time with families with special needs children. Then as my career progressed, I felt I need more skills than just medical knowledge. So that is why that led me to my passion. I asked where my passion was. Having conversation with people. So I went into coaching. And in 2022, I achieved certification as a master coach with International Coach Federation. And then in 2021, I was with you in your TTT training and qualified as HRD Corp Certified Trainer. And I've recently submitted for accreditation as well. Wonderful. Public speaking, I've been in Toastmasters for the last 7 years. And that has been a lovely journey in that thing. So combining my medical experience together with the coaching and training, as well as public speaking, is what gives me the skills for leadership and to deal and to work with others. That relates to our topic today, leadership and people skills.
Wonderful.
That's my background. Yeah.
Sure, Doctor. Wonderful. I'm glad to have my another good friend, Dr. Lucy Newman, all the way from Nigeria. Welcome, Dr. Lucy. Good morning to you. And hello, Fitri. Nice to see you. Doctor, they say being a medical doctor is just not a profession. It's a calling. And for you to be in this profession for 36 years and still actively, I see, enjoying the process, not only treating children, but also coaching the parents. We'll come to your book in a while. But tell us, what inspired you to be a medical doctor and enjoying this for so many years?
That's a very good question. From childhood, I grew up, it so happened I grew up among a number of people related and not related with chronic illness. So I saw the challenges that they went through, and also had the opportunity to meet various doctors who dealt with these challenges and supported them. See, this sparked an interest in medicine. What went on to inspire me is when I looked at the challenges that they were facing. So I saw this is an opportunity to heal to educate and to support people in their vulnerable moment. And when you are able to do that, and when you do it genuinely, you create an impact in that person's life. And I think that is what that resonated with me and inspired me to make an impact in a person's life. And as my career went on, that's when I started with these same thoughts to heal, to educate, and to support parents of children with special needs. And it makes an impact in their life. So, what actually inspired me is in this profession, you can make an impact in the life of others.
Wonderful, doctor. Wonderful. I really love the idea of impacting the life of others. And I was inspired with your passion for learning. Finishing medical school and finishing the specialist course itself take many, many, many years. And in between your commitment to manage patients and your other leadership roles, you still take the initiative to attend our courses like Train the Trainer, coaching programs, and many other. In MAPS, we are in the same Malaysian Association of Professional Speakers, attending coaching courses on authors. That's just amazing. But let me come to this essence of our discussion today. Why leadership and people skill? Can you tell your perspective? What are some of the people skills and leadership challenges doctors commonly face?
Yes. I would like to look at this question from my my perspective, as you said, and about myself. What was the struggle I went through, right? And the very reason for that is leadership starts with self leadership. You have to be self leadership first before you lead others. So, what were the issues I had as I went? Yes, I am passionate about it, can make impact on others. Then I realized that the first thing that I had was communication style. Communication is an issue because we are running busy clinics, right? We are doing busy clinics, and we've got many commitments, ward commitments, clinic commitments, and then in between, you as a pediatrician, you're called for delivery. So your communication, you're sometimes not thorough. You may be choppy, right? And very prescriptive. Communication was an issue. That's the issue. Then number two is empathy. Many a times I tend to give opinion based on what I think. These are the self-awareness that came to me. Yeah, empathy is also a issue that I faced. And teamwork. You're so much into your work, and you have got two sorts of teamwork. You work with your colleagues, and also you have to work with the others in the hospital. So sometimes this communication, if the communication is not right, you have difficulty in teamwork, right? When you do not understand the other perspective, but always come from your perspective, there are issues in teamwork. So that comes. And again, when coming back to the communication, sometimes I also think back, did I actually hear well to what the patient said? Did I understand their perspective, or I was just prescriptive? And another thing is, in a busy situation, you have to make decisions. Yeah, we are clinicians. Many a time you have to making decisions under pressure, is this. And now, as clinician, you also have to take management role, whether it's a government hospital or a private hospital. Yeah, like I'm the clinical head for pediatrics in my hospital that I work in, Hospital Fatima. So there are times where I have to make decisions along with my medical director, and some decisions will be popular and some may not be popular. And how are you going to deal with this? Do you want to please others, or do you want to make the right decision? So making decision can also be an issue. And what is now the trend is From paper and pencil, we are going into technology, and we have to keep up with it. And one of the things is we write insurance report. So now it's all coming into technology, and each firm has their own forms to fill. You have to learn, and above this, you have to not only keep up to date with the medical technology, it's also up to date with the treatment. It's not what I learned when I was 1987. Now things have evolved a lot, so we have to keep. So these are the I feel these are the issues that I faced in the leadership and in developing leadership and people skills.
Yeah. uh, wow. I hear the word empathy, communication, teamwork. Let us explore further, Dr. Shan, perhaps in the subject of communication. I thoroughly understand that this could be confidentials, and what you can share and what you cannot share. But for the benefit of the audience, can you share some of the possible communication error clinicians, medical experts can make in missing in the prescription, for example, especially when dealing with uh, parents with young kids who may have language barriers or who may not be able to comfortably explaining, or the doctors are super busy, especially with government hospitals with limited resources, and the doctors are working very, very hard all the time. What could be some of the communication challenges medical professionals have, and their consequences to the treatment?
First, firstly, firstly is the time factor and the number of roles that we have to do. So, so my perspective is sometimes our mind may not be addressing totally what the patient is saying when there are another 20 to 30 patients sitting outside there. So we tend to hear, this is what I realized about myself, what you want to hear. And then you make a conclusion based on that, right?
Sure.
Um, you understand what I'm saying, right?
Yes,
So
doctor.
so
Yes.
this can give rise to errors. For simple thing, cough. If you don't listen very carefully to it, is it a sore throat or it could be something more sinister, like it's a pneumonia? You need to ask more questions to discern between the two. But if you're in an outpatient clinic, like in a government setup, you have 50 patients waiting and you have to finish them by 1 o'clock, pressure may happen. And then this is where active listening may not be there. It's listening to what we want to hear, and then we make a decision based on that. And a solution to that is to have more doctors. And I think, and then the patient crowd is divided among doctors, and then we have more time. The second thing about communication is communication starts with listening, right? In my early years of practice, I was very prescriptive. Okay, cough, this, it must be this, and this is the treatment. And I used this for a long time until I started working with parents with special needs. And then I always felt there was a communication barrier between them and me. And then I listened, and then I thought about it, and I said, yes, in this situation, I have to listen more to them to understand their perspective. Because when you deal with families with chronic illness, it's not just about medication and prescription. It is about understanding where they are coming from and then to engage them so that they follow the instructions that you give. So communication starts with active listening. And this active listening, whether it is in acute situation where it's mainly fever, medical problems, or in special needs situation or in management of team, I think the listening is very important. Listening to see, listening to understand what is told, listening to understand what the problem is, instead of straight away going for a solution. Under pressure of time, you'll always be going for solutions.
Wow.
So that's one issue about communication. Is there anything that you want to clarify in what I've said?
Yes, yes, Doctor. I'm just listening and listening to you. I realize, and you being a coach, I'm sure you are very much aware. I had the privilege of attending coaching programs, which gave me an awareness the significant difference between hearing and listening. And throughout my life as a student and a teacher, I've not really formally been trained in the art of listening. And that seems to be such a critical skill. Do you think, with due respect to the very, very comprehensive and perhaps one of the toughest education system being a doctor, do you think doctors are exposed with this powerful skill called art of deep listening or empathic listening? Can you share your perspective from for a medical doctors from their early days of training, whether they are given the opportunity for learning about listening?
See, in my training, it was very clinical, diagnostic, treatment, management. That is in 1987, in the 80s. It was then, and we were made very good clinicians, so we could make diagnosis, treatment, treat well, do necessary investigation. But as I can remember, there's very little during my training about these areas of leadership, communication, listening. I think in the newer curriculum, where it's problem-based curriculum, they are bringing in these into medical schools, the now current curriculum. See, this is why I realize self-awareness. I lack the skills. That's why I certify myself as a trainer, as a coach, right? Went into public speaking to pick up these skills. So to answer your question, during my time, the emphasis was uh, minimal on these areas. But now, in the more recent curriculums, I know communication is being included. To what intensity? Sorry, I'm not able to because I'm not in the uni. I do not know, but I know from students who come for attachment with me that they do discuss about communication.
Wonderful, wonderful. If there are doctors here, uh, if there are professors from the university, if there are officials from Ministry of Health, I hope we are all aware that when Dr. Shan mentioned about the significance of the art of listening, and I believe, correct me if I'm wrong, Dr. Shan, the art of listening is also a skill, perhaps the tool to diagnose. Without the depth of empathic listening, you may even miss critical information that may be required for you to diagnose your patients. What do you think, doctor?
Yeah, diagnose and beyond diagnosis, I agree with you see Dr. Lucy's comments there. It is to engage the patient. See, you engage when you have empathetic listening or active listening, and the patient knows, oh, you're treating them importantly and listening very carefully to them. They may reveal information that they were holding back, because they're scared a major diagnosis will be made. And you engage them better. And through the engagement, they will then begin to follow your advice and become compliant to treatment. This I realized this. See, as I shifted from main acute work to special needs work, the parents were not engaging with me in the initial years. And I was wondering why. Is it me? Is it them? So initially, obviously, you'll tell I did my job right. So the parents not understanding. But it was becoming consistent. That's when I took a step back and I thought, oh, I did not understand their perspective. And when I became a better listener and listened to them, and I knew where they were coming from, then I managed to engage them. For an example, with the special needs child, every parent want their child in a regular school, right?
Yeah.
When I was younger, that's the prescription. Your child has got this difficulty, so will not manage in a regular school. You have to go to a special kindy or a special school. And I saw parents were getting upset with me. Then with time, I realized this is the aspiration of a parent, a dream of a parent for their child.
Exactly.
Yes, when I understood that, then though my clinical decision was this child will have difficulty in the regular school, I never discouraged the parent from sending them. Because only when they send and they experience the difficulty seeing, a parent is not going to let them struggle. After some time, they'll come back and say, Dr. Shan, they are not managing. What should I do now? And this is the time engagement. Just because I had listened to what they wanted, though I knew this child may not adapt in a regular school, but I agreed with them. You want to try? Please go ahead and try. School of your choice. But after 3 months or 2 months, the child is struggling. The parent can see and feel it for themselves. They come back, then they follow what you say. So, empathetic or active or deep listening improves the engagement. Yes, it helps in the diagnosis, it also helps in them following the treatment, being consistent, compliant. And this is more so important in teenagers. If you want them to engage them, listen to them what they have to say. We don't need not follow everything they say. Listen. And that's the younger generation as well. With the young parents, I will, like, for one thing, when I was training in UK, there was a mummy with a child with just 1 or 2 drops of runny nose. And for me that was a small matter, and my prof, I didn't realize my prof was observing how I dealt with. And I told mom, don't worry, this is small matter. But she didn't go out comfortably. Then the prof spoke to me and he said, Shan, that 1 drop for you is 1 drop. But for a mother, it's a torrential rain. That is a mother's perspective. So just reassure her. And then you see how she herself will realize this is not a big problem. Rather than brushing aside, no, it's just 1 drop. Right? So that learning is still in me. So nowadays, when I see young mummies who have no experience, first baby, simple things, they sort of worried about it. I show that I understand their worriness, but actually this is okay. A baby having hiccups, baby who can continue to have hiccups for 10 to 15 minutes. That's a big worry for the mother because it will be the baby. She thinks that it will create pain for the baby. So, but we do understand babies' diaphragm sometimes gets active and they get repeated hiccups. And after 5 or 10 minutes, it will stop. So we just reassure them. So the deep listening creates, yes, better diagnosis, but more so engagement, which leads to compliance, satisfaction, and then they then develops the trust.
Indeed, indeed, Doctor. On behalf of the perhaps entire human race, we are grateful to doctors. I've been father, with babies. Before meeting a doctors like you, our mind will be so worried, and so many worries. And just a word of assurance from a doctor, we will come back from the treatment room with a peace of mind. That is what doctors are, the gift for the human race. We are so grateful. And while we are talking about listening, paying attention, if some of our friends from the hospital, I hope you're not scolding us, I understand you have so many constraints: time, resources, and equipments, bed. Tell me about it. I only wish government officers, perhaps Ministry of Finance, whoever coming up with the budget, please, 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 we need more doctors. We need doctors who have time for patients. And our doctors, especially from my experience in government hospital, they are so hardworking. They are working so hard with such a limited resource. I wish government allow more medical doctors to help us. After all, health of the nation is the foundation for building a country. Having said that, doctor, while communication and all could be a subject, when the doctors need to pass their clinical subjects and qualify, I'm not sure whether leadership, especially when they are struggling to pass the exam, or their housemanship and the early years of MOs, I'm not sure whether they will have time. So, what will be your advice for doctors to improve people skill? And I'm so glad professional body, which I'm member of, Project Management Institute, recently reclassify soft skills as power skills.
Yes.
Previously, communication, listening, negotiation, all these emotion, all these are perceived as soft skills. You know, compared to functional skills, a hard skill or technical skill, soft skills gave us an impression it's okay if you have it, but it's not that critical. So professionals, thought leaders, researchers have emphasized communication, for example, that we spoke about, should not be called as a soft skill, but should be emphasized as power skills. So, from your vast experience, what are your suggestions for doctors to improve their, let me emphasize, power skills, including leadership, communication, negotiation, etc.? Can you share your perspective, Dr. Shan?
Yeah. To me, first is self-awareness is very, very important. I speak from my perspective, from my experience. I mean, how come, why I have uh, come to realize the importance of what you call as power skill, which includes the communication and people skills, which is very important for a leader, is my own awareness, everyday practice. And I see, and I, through the years, I look at the response of the parent to me, then I think back whether they have understood the body language. Does it tell me that they have understood what I've said? Have I got what they have said? So it's self-awareness of my own work and my own strength and my own weak areas. That's where I realize I need more emphasis on this, what you call the power skills. And that is what that led me to go and attend workshops on leadership skills, on soft skills. What you attend workshops to learn skills.
Exactly.
Number two, and that is what that led me to become a trainer and a coach, as well as to go into public speaking. And that's where I learned a lot about communication skills, effective communication. So, what I feel is, when you have, first thing is, rather than me telling you that you have this difficulty, that difficulty, that we can do that, but there must be self awareness. And when they have the self awareness, there must be the resources. You need to attend trainings, courses, the workshops to improve yourself in these key areas.
I love that, Dr. Shan, when you said awareness, self awareness. Reminds me, I'm not sure who said that. Whoever said that, thank you very much. Change begins with ABC: awareness before change.
Yes.
awareness before change. For friends listening from an experienced doctor, I hope this inspires us that listening, communication, the significance of it starts with awareness. And I hope my conversation, the privilege of listening from experienced doctor, coach, author, leader like Dr. Shan will create at least the awareness. Let us go back to your where I first met you, Dr. Shan, in the HRD Corp Train the Trainer program.
Yes.
Let us, because I mean, beside you, I had a few other medical doctors in my class, professors from medical faculties in my class. And I thought it would be such a wonderful opportunity if more public can meet medical experts, not in hospital when they are sick, but in other settings for them to have knowledge. For car, for example, we send the car to a workshop for routine maintenance. I send my car for maintenance when the car is healthy, in good condition. But I go and see a doctor only when I'm sick. In another word, the car get privilege of preventive maintenance. I get the alternative of what we call as corrective maintenance. What a pity. The car get more privilege than the owner of the car. And when I see medical experts like you in training, it's such a wonderful opportunity for the public to get medical advice and other healthcare related advice before they are sick. Prevention is better than cure, but unfortunately in healthcare, I guess most of the people will only go for cure rather than prevention. Please tell us more. What inspired you to become a trainer, and what is your suggestion for doctors there to help more healthy people to remain healthy or become healthier by, if I may use the word, preventive healthcare?
For me, becoming a trainer, I would say, is a natural progression. Why do I say that? Because in my practice, my main practice, and many of my clients come to me for this one reason. I will explain. I take time to explain, though I have to go back late. Because if I don't do that, I feel myself I have not done a good job. So if a parent wants newborn baby, I usually spend time, at least 10 minutes, explaining all what are the norms that they can expect, especially first time parents, right? What you can expect. The baby will be sneezing. That is not considered as cold. They will have hiccups, and babies sleep more during the day and night than night in the first month because they don't have a biological clock. See, these are little things that for the new parent, they're thinking whether there's a problem. My child is sleeping during the day, not sleeping in the night. There's something's happening. So this I always spend time to explain to my parents, and I use a lot of visual aids, pictures. If I said the child has got asthma, to emphasize that, I've got a set of slides. We go through the relevant slides so that they can see what happens in an acute episode where the air tube becomes narrow and is filled with phlegm, and how the nebulizer or the inhaler helps to open up. So when they can visualize it, then they understand better. So in my practice, I do that, as well as with families with children with special needs. I do that. So I thought to take it to the next level, as you say, to preventive. So you need to get certified. So you need to go and train the right method of doing this, of developing a plan of how you want to train them. So that is what that led me and inspired me. And I know you are an excellent trainer. I've heard a lot about your training uh, and your storytelling as well, which makes an impact. So I personally contacted you and came for your classes.
Wonderful, wonderful, doctor. I'm so glad my niece Kasturi, who is a first time mother, though she's a nurse, trained nurse, after meeting you, she came back with so much of confidence in treating, or rather being a mother. Thank you so much for that. I'm sure meet hundreds or thousands of mothers like you left your clinic with a peace of mind. Mothers like Kasturi, I meant, with a peace of mind, and doctors all over the world, like I mentioned earlier, a few minutes of conversation give us, the untrained mind in medical world, such a peaceful sleep at least. Thank you for that. And friends, Dr. Shan, besides being a doctor, he's also an author. We will come to his book. So parents with special child, especially autism, perhaps this is a great opportunity to raise any question, and you will have an opportunity to get more detail from the book title, Why Me, by Dr. Shan. I read the book. I had the privilege of going for the launch of the book. No, it is such a easy for laymen like us to understand from a medical perspective. And it's beautiful when it is actually also a conversation with a mother who is caring for a special child. And the mother is also our friend and a fellow Toastmaster, Madam Mohanita. So a conversation by two friends seen in a book, it's a joyful reading. I would strongly suggest anyone with interest on autism to look out for this book. Thank you very much. Dr. Shan, our common interest, I had the privilege of working under your leadership on Toastmasters. I've been a Toastmaster, what now, for about 2 decades. And I may be busy for my next class, but I have missed out preparation sometimes in more focusing on preparing for Toastmasters. Even though it's a pure volunteer, it gives us so much of joy. For those who are listening there, Toastmasters is been since 1924, for almost 100 years, managed by volunteers. How come an voluntary organization lasts for more than 100 years in 148 countries with hundreds of thousands of members? Can you, for the benefit of our audience here, tell how Toastmasters, what inspired you to join Toastmaster, and perhaps how Toastmasters can help doctors and other professionals in their leadership and communication skill, Dr. Shan?
Thank you. Toastmasters is a passion, right? So can speak freely about it. You see, Toastmasters is transformative for me. Transformation, full transformation of me. We are seeing Shan confident today, speaking here with eye contact. It's all from Toastmasters. I'm an introvert, very quiet guy. But see, 36 years as a pediatrician and longer in this world, there's a lot of experiences. And it has always been within me. I want to express my life experience as well as my experience as a pediatrician in messages to others so that it creates an impact or it's helpful to others. And when I was in this process, that's when I came to know about Toastmasters. That is about 7-8 years ago. And the very first thing that I gained from Toastmasters is confidence, is self-confidence. Because Toastmasters is a very safe environment. You are among friends with a similar purpose who want to express themselves, improve their communication, and some would want to improve their leadership skill. And a safe environment, no one criticizes you. When you present, when you talk, you are given feedback, what we call as evaluation, in a very encouraging manner, which supports you to grow further. And that's what that has enhanced my communication style, speaking. see, public speaking and becoming an effective communicator. And again, also when you are into public speaking, is again comes is active listening, because when you want to be an evaluator, when you want to give evaluation to someone, you have to listen carefully to what they say. That's number one. Number two is it has helped me to articulate my ideas, and then ability to inspire and motivate others. And if you want to be a leader, this is very important, how you express yourself, how you engage others. Because the first thing in preparing the speech is you want to understand your audience, and then you want to write the speech accordingly. So if you bring this to my clinical practice, the words I choose when I speak to a mother has to be appropriate to what she is. A basic, simple mom, I use simple words. If she is a corporate level person, then I can use. If she's a medical person, I use. So I understand my audience. Audience doesn't always mean 100 people. One person that I'm talking to is also my audience. So if I understood my audience and I speak accordingly, I can engage. So that's how I bring what I learned from Toastmasters into my practice. That's in communication. In leadership, I had the opportunity of becoming a division director 2 years ago and had Dr. Prabha as my advisor. And that's where you learn about strategic planning, plan for the division for the entire term. And also, you learn how to deal with different types of people. You are developing people skills. And in any NGO, you're going to have very nice person and you're going to have very difficult people. And with the very difficult people, that's where you learn a lot of people skill, how to engage them. And I felt the best one was listen to them. And sometimes silence and listening itself can help you, give you time to get solution, to come out of difficult situations without major conflicts. We always rush to talk, but I felt that leadership post there taught me, don't rush to give an answer. Listen carefully, see where they are coming from, and then you take action accordingly. So that gave me opportunity for a lot of leadership skill. With the good communication, you can and expressing yourself, that helped in the leadership, together with the thinking as a leader for planning for our club, planning for the future, bringing it back to my work, giving me ideas how I can develop my practice further. And that is where I felt that I have this wish to become a trainer, and then become a parent trainer, and also use my training ability with the medical fraternity as well. So um, so it has helped me personally, and it has helped me professionally. This 7 years journey with Toastmasters has been a real wonderful journey. And I'm sure it will help a lot of our doctors and others as well, similarly in their communication style, in their confidence, and how relating and leading others.
Wonderful, doctor. I'm glad I'm also a member of your club, the Bunga Raya Toastmasters Club, bilingual. And I recently saw your interview in Bahasa Melayu, which was so fluent. And also, I managed to, I hope, reply your pantun. Whether it's correct or not, I got to ask Sita Lachmi, my wife. But it's such a joy of learning new skills. And doctor, I am aware of your passion for helping special child. And tell us more about it and how mothers and parents and other caregivers for special child can benefit from your book or other services that professionals like you giving to help caregivers with special child and the child themselves.
The working with families with special children, any special needs, it's a team, and a pediatrician is a member of the team. And we play our role there is diagnostic. One is to diagnose, and then to chart out a plan for them, what is the therapy they need, where they need to go, and review to see the progress of the child. So during I do special needs clinic every Wednesday in my clinic, and what I noticed was many parents, when I give them in the initial years, when I give them the diagnosis of autism spectrum disorder, this has been on the increase. They just break down and they they cry that they are lost. See, whether it could be a father or a mother, they just break down and they cry. And I lacked the skill how to deal with this. So I thought silence, just give them the time uh, to cry, and then they compose, attain their composure back. And when I went to thought, then I realized that's where I went into coaching. That is the main thing why that led me to coaching, how to deal with this situation. The next thing that came across is many of the parents, after the diagnosis, you explain to them, they're still lost. What is the direction to go? What does all this diagnosis mean to my child, and how am I going to bring my child? That thing, plus, without fail, at some point, the parent will ask me, why do I have to have this child, doctor? Why me? So this was happening over my years of practice, over the last 20 years that I've been working with these families. And that was the inspiration for me to write a book as a guide to the parents, and also so that they can develop their direction.
Nice.
That's how I decided to do. So when I joined Malaysian Association of Professional Speakers, they had a book writing workshop. So I joined the workshop and I set a challenge to me that, okay, I'll express myself. It's only after I got into the workshop and set the challenge, I realized it's not an easy task, because you must first understand your audience. My first version of the book, and I gave it to my mentor, Fu, and she asked me the question, Dr. Shan, who did you write this book for? Parent. It looks like a book for doctors. Too many technical terms here and there. So it went through three times. I had to bring it down to a very simple language, and the third version was, okay, I'll make it as a conversation, a real story of a mother's journey with her child with autism. So brought it down to very basic English, right? And added some humor here and there to make the flow good, and a real story. And that's Mohanita, who is a fellow Toastmaster as well, with her son Muhaimin, who also attends online our Toastmasters every now and then, comes and says hello to her. The message in this book, the summary is, the British singer Adele,
Mhm.
her name is the acronym for the message in this. First is acceptance of your child as he or she is. It's only when acceptance comes you can move forward. But that acceptance is a very personal thing. Parents go through a journey to come to terms that their dream is not dashed, even though the child has autism. When they come to that acceptance. Next, the D is, once you have accepted your child, you're looking for a direction. Now, what do I need to do to bring out the potential in my child? Direction, D. And when you are in the process of the direction, comes the E, which is the empowerment. You must empower yourself. A parent cannot always depend on the professional. They're with the professional for a couple of hours, but the rest of the time is with the parents. So they empower themselves. Okay, you list down your question, you ask your pediatrician, and then you do reading, and you're not clear. You can ask your pediatrician or the psychologist or the doctor or the therapist that you see, and you attend courses, you empower yourself, you discuss with other parents what has worked out for their child. Try empower, ADE. And when you have in that process, you are becoming a leader for your child. After some time, you, if you are facing a new problem with the child, You will straight away go out looking for the answer. You won't think, I don't know what to do. You become a leader for your child. And the last LE is you become a leader for the parent, other parents. So, Mohanita, this is her story. She went through a difficult phase to accept. Once she accepted, she developed a direction. She empowered herself. She became a leader for her son. And now she's a leader for other parents. I now ask her ideas. If I have some behavior difficulty I can't deal with the child, I'll just give her a call. I say, Monita, what's your experience? What can you say? What's the
Nice.
ideas? And she gives me suggestions. Yes. So now she has moved, she has completed the Adele. But
Yeah.
first thing is you need the ADE to become a leader for your own child. And
Beautiful.
then when you're comfortable, you go to the next. So that's the message in this book for parents. My aim is parents become independent and they are able to manage their child and bring the best out in their child. That's the inspiration and the message from this book. Why me?
Wonderful. I also like to take this opportunity to thank Malaysian Association of Professional Speakers for helping to bring the wisdom from Dr. Shan and our good friend Mohanita into a book that laymen like us can read. Thank you very much, Maps. And my friends, what a joy listening to Dr. Shan for the last 50 minutes or so. His journey at the early stage in profession, medical profession, and how he had the awareness that communication, leadership, people skills is an important skill. And he took the initiative, the desire to equip himself with professional qualifications beyond clinical skills, train the trainer, coaching skills, writing skills, leadership skills, and communication skill through Toastmasters. And I'm sure there are many more initiatives that Dr. Shan is. For those of you who are interested to transform your expert knowledge into profession called trainers, do visit us at www.smctrainers.com. And there are many other professionals like me who are conducting Train the Trainer. Many of them are my good friends. You can always reach out to many other trainers. I believe, like Dr. Shan, when you acquire the skill of being a trainer, you can help many more people, including in Dr. Shan's case, parents. Like I like the idea when he said audience analysis. It sounds too technical, but when Dr. Shan speaks to a fellow doctor, the same subject, the language, and the context could be different. When she is talking to perhaps an uneducated mother, he will have the ability to bring the language to reach the mother for her or and the parents to understand. So, Dr. Shan, on behalf of all the audience, we would like to thank you and we would like to thank the entire medical profession for bringing so much value to us. I wish you all the best. And once again, thank you very much, Dr. Shan.
Okay. Thank you, Dr. Prabha. Thank you for giving me this opportunity, as well as giving me the opportunity to attend your training, TTT, and acquiring the skills to be a trainer, and today sharing my experiences. Thank you for this opportunity. Thank you. Good night, Dr. Prabha.
Good night. Thank you very much, my friends.